Greetings, students. I'm going to be recording my questions for my content that's going to be on the comprehensive final exam. There'll be 12 questions from the ICU content and 10 questions from the PEDS GI content. On the ICU, be sure and go back and pull your notes and know what the RSBI number is and know what that number means as far as weaning, because there's a cutoff number for success and for likelihood of failure of weaning. So just go back and look at that. Make sure you understand those numbers. If you have any questions, let me know. ABGs, make sure you know how to interpret ABGs, and there will be more than one of those. Waveforms, make sure you know what a typical arterial waveform looks like. We also, when we were in that lecture, we went over how to actually also label a waveform. So just make sure you understand what they look like and how to label them. How to figure mean arterial pressure. We went over that. There's a handy dandy formula. Make sure you go back and find the formula and you know exactly how to figure the MAP according to the notes. If you don't, then please let me know. Make sure you know about the appropriate interventions during extubation of a patient. Y'all had some trouble with that last time. If you'll remember about when you should pull the tube out, and remember you suction, you have them cough and start suctioning. Extubation, if you think about it, do you want that on peak inspiration or peak expiration? So if they've done peak expiration, then the next thing is inspiration. Do you want them inspiring all those fluids? No. So after peak inspiration, they're going to be doing expiration. So you want to do it at peak inspiration. Swan-Ganz reading values and reasons for abnormal values. Go back and pull the Swan-Ganz readings. Remember, we had those different colored cathlons, and each one told you different values. So make sure you know the normal value range and the reasons they're abnormal. If you'll remember, if they were high numbers, mainly it was related to hypervolemia, and if they were low numbers, hypovolemia. If they were high numbers, it could also be enlargement of that side of the heart. Make sure you understand about the Allen test and why we do that to assess for circulation, collateral circulation. And when we're supposed to do that, it's right before we draw ABGs in that hand. So make sure you understand about the Allen test. Make sure you understand the plebostatic axis and where it is located and how to locate it. There's a chart in your med-surg book that goes over how to locate the plebostatic axis. Lab values in general, this is just a review question that's going to go over some lab values. There's one question also that I threw in there about the lymph nodes, so make sure you know the lymph chains in your neck. That's a review question. Time frames to convert from a ventilator to a trach. How long do they have to be on a ventilator before we put a trach in? And what causes high pressure alarms to go off? There's a chart in your book, and it's also in your notes in the ICU content. So that's all that's going to be over the ICU content. For the PEDS GI content, there's 10 questions. Make sure you know about the treatment of Hirschsprung's disease. Make sure you know the plan of care for GERD. So just look up treatment plans in your book on GERD and also in your notes. And remember, it was things like thickening the cereal, thickening the formula a little bit with some cereal, keeping them upright for 30 minutes after feeding, things like that. Make sure you know the difference between Rothson's versus rebound tenderness signs. Make sure you understand about positioning, particularly after cleft lip versus cleft palate repair. Know the purpose of a barium enema with water and air contrast for intussusception. We talked about that. If you'll remember, most of them are using air contrast with water now instead of barium in case they have a perforation to keep that from getting out into the perineum, into the stomach. You also want to you don't want them to get peritonitis. You also want to make sure that you understand why they're doing that. Remember I said the concept of blowing up the balloon? And then if you were to take one of the fingers and imbagnate it back into the balloon, that would be the same thing as intussusception. So if you think about going to the other end of that and blowing air real hard again, sometimes that will make that pop back out. Celiac disease, remember that. It's lifelong. They're always on a gluten-free diet. And remember what they can have, an RC, rice and corn, but don't dairy that brow. barley, rye, oats, and wheat. Signs of perforation and appendicitis, make sure you understand that and that you would need to notify the physician if those occur. Signs and symptoms of biliary atresia. So go back to biliary atresia, make sure you understand the signs and symptoms. And then go back to your types of dehydration in children, ISO, hypo, and hyper, and make sure you understand the types of fluids that each type of dehydration would be receiving. And that's it for my part. If you have any questions or concerns, please let me know. Thank you.